Welcome to our EHCP or Education Healthcare Plans section. Education Healthcare Plans or EHCP are for children and young people between the ages of 0 and 25. EHC plans are designed to give families more control over how they are supported. Having an EHC plan means the different agencies that provide education, health and social care will work together to help children and young people achieve their goals. Before children and young people get an EHC plan, they must have an EHC needs assessment. If a child or young person has a learning difficulty or a disability which is holding them back at school or college, their parent should speak with the class teacher or special educational needs coordinator, SENCO, as the first step. Schools use a graduated response to meeting needs for children with SEND. By taking this approach, earlier decisions and actions are revisited, refined and revised with a growing understanding of the child or young person's needs and of what support will help to secure good progress and good outcomes for them. For most children and young people, the additional support provided by the education setting will enable them to make good progress. If the parents of the child or young person, or the young person themselves, believe that the school or college is not able to provide the help and support which is needed, then a request should be made to the local authority for an EHC needs assessment. The following people can request for the local authority to conduct an education, health and care needs assessment for a child or young person aged between 0 and 25. The child's parent, a young person over the age of 16 but under the age of 25, and a person acting on behalf of a school or post-16 institution. This should ideally be with the knowledge and agreement of the parent or young person where possible. On receiving the request for EHC needs assessment, a business support officer will log and date the request on our information system and allocate to an EHC coordinator. The business support officer will also notify partner agencies of the request, including children's social care, health services, and education settings. The EHC coordinator will contact you by telephone, followed up in writing, to let you know they have received the request. During the telephone conversation, the EHC coordinator will introduce themselves and their role, explain the process for considering an EHC needs assessment, agree a date/time to meet you either at home or education setting. The EHC coordinator should also agree with you how you would like to be communicated with during the process and inform you of your right to provide written or oral views and submit evidence to the local authority. For full detailed information on EHC plans, be sure to visit the relevant section of Wirral, Send Local Offer, which is linked below. There you will find all of the in-depth information and guidance you need.